every brilliant mind. Wish you a grand welcome to the largest online platform for dental student, Exist Dental School. Following the motto, Journey Toward Excellence, exists continuously arranging many great sessions. We all are concerned about our studies, our skill development, and overall our life in this pandemic situation. But it is exists, which comes to us as a blessings. It makes our time so valuable and designed our life more smarter as well. Exist covers the deprivation of our academic life by arranging some crucial sessions. Paper presentation competition is one of them. I'm very grateful and would like to thank our Honorable President Farhadul Islam and all the great minds of our Exist Dental School working behind this program. It is my pleasure to say we have successfully done 4 episodes before, and today we're going to have an amazing episode with the topic chronic gingivitis. Throughout the competition, I will be your moderator. Hello, this is Naimur Rahman from Rashmee Medical College Dental Unit Session 1920, and also the academic coordinator of Exist Dental School, welcoming all of you to the 5th episode of our program. With the gift of amazing, admirable sessions, Exist has gave us the opportunity to meet and greet honorable teachers across the country and abroad. It is my utmost privilege to introduce our honorable, respected judges. First of all, I'd like to introduce our foreign judge, Dr. Manoj Humagain, sir, from Professor and Head from Department of Periodontology and Oral Implantology from Kathmandu University School of Medical Science. Then, with topmost pleasure, I'm introducing Professor Dr. Zakir Ahmed Shaheen, sir, Unit Head, Dhaka National Medical College, Dental Unit, Dhaka. And last but not the least, our renowned mentor and advisor of Exist Dental School, our favorite, Dr. Anupam Podder, sir, Associate Professor and Department Head, Periodontology and Oral Pathology, Dhaka Dental College. Thank you so much, respected judges, for being the part of today's show. Finally, I would like to introduce our brilliant competitors. First of all, Faiza, Farhan, Rashmee Apu from Dhaka Dental College, session 17 and 18. Nusrat, Jahan, Saima Apu from Chattagram International Dental College, session 17 and 18. And final, Proma Ghosh Apu, Kumudini Women's Medical College from session 17 and 18. And now, I would like to request our honorable judges. It will be very helpful for the presenters if you could share some of your valuable advice with our presenters and audience. I would like to start with Manoj Humagain, sir. If you could please share your word with us, sir.
Thank you, Naimur, and thank you, Anupam da, for this wonderful experience to be the judge of this session on chronic gingivitis. It's a very important topic, and I believe all the presenters are going to highlight about it, and they are going to talk about the different aspect of it. And I think if at the end I could give some comments, I think that will be more better. Thank you for inviting me as a judge, and I hope I can do my assigned job perfectly. Thank you very much.
Thank you so much, sir. We are beyond excited to have you here. Next, I would like to request Professor Dr. Zakir Ahmed Shaheen, sir, please share some of your knowledge with us and the audience, sir.
Please unmute. Please unmute, Zakir sir. Please unmute.
So for your information, your mic is.
Okay. Now it is okay.
Yes, sir. Please continue.
Can you hear me? Okay. Thank you, moderator. Thank you, moderator. And I would like to thank Exist Dental School. Exist Dental School, they will arrange this type of presentation I like it mostly, and I hope all the presenter they will doing their good job in this presentation. So I thanks everybody for their good success in their presentation. Thank you all.
Thank you so much, sir. We are very lucky to have you with us. Finally, I am requesting our favorite Dr. Anupam Podder, sir, please share something for the presenter, for the audience.
Thanks, Naimur Rahman,
Sir.
for your nice introduction to me and our wonderful moderator of today's session. Very good evening. Honorable judges, Professor Dr. Zakir Ahmed Shaheen, the Unit Head, Medical College Dental Unit, National Medical College Dental Unit, and Professor Dr. Manoj Humagain, come from Nepal, Kathmandu University of Dental Science. We are very grateful to them because they are very busy practitioners, but they are with us due to academic interest, sharing knowledge to our beloved students. Today's participants come from Dhaka Dental College, Chattagram International Dental College, and Kumudini Women's Medical College Dental Unit. Thanks all of you for their active participation. I have some advice to our participants. These are: we evaluate you by your topic discussion, slide preparation, explanation with diagram, inclusion of evidence-based data study, understanding of the subject, response to question and answers, reference uses, dressing sense, and presentation skills, and maintenance of time. In here, the time is very sensitive. If always you maintain the time, and judges, 3 judges give 100 marks individually, and we then divided into divided in 3 parts, 3 and aggregate 2 marks of judges and divide into 100%, and also include 10 marks from social media, love, care, like. Those are previously declared in social media. We also calculate marking on today's moderator about his performance. I also thanks to viewer who are showing program or upcoming viewer, and also thanks to Axis Dental School and also its event management team for share this type of great job. Best of luck all presenter and moderator. Thank you.
I have one question, that is, how much time is individual?
Sir, we will discuss it later.
10 minutes time for individual student and 2 minutes earlier they call to presenter. You have only two minutes time, and first of all 3 presenter present 30 minutes, and then question and answer session and discussion for 15 minutes. That is totally 45 minutes for our session. Thank you.
Yeah, thank you.
Thank you so much, sir, for your amicable words and instruction. Hope that our presenters mark that every word from you. And again, I'd like to thank Axis Dental School for this opportunity, and all the best to our presenters tonight. So, ladies and gentlemen, I know you have been eagerly waiting for this competition. So now, let me allow to read the rules of this competition. So here are some extremely simple rules. Each participants will get 10 minutes for their presentation. After 8 minutes, I will alarming all of you that you have 2 minutes left, and then within 2 minutes, the participant needs to finish their presentation. Finally, after the presentation, there will be a discussion part among the judges. So we're going to have a very amazing and interesting competition right now. So first of all, I would like to request our first presenter, Faiza, Farhan, Rashmee Apu from Dhaka Dental College, session 17 and 18. Apu, could you please share your presentation?
Yes, thank you. Hello, everyone. Assalamu alaikum and adab. This is Faiza Farhan Rashmee from Dhaka Dental College, and my session is 2017 to 2018. And without any further information, let's get started. And this is a glimpse of my beautiful college. And today's topic is chronic gingivitis. And my contents are definition, characteristics, and classification of gingivitis. Before knowing the definition of gingivitis, first from the name, we can already understand that there is an itis in the name gingivitis. And anywhere where is itis, it means inflammation. And gingiva means gum. So gingivitis means the gum inflammation. And here's the definition. Gingivitis is a reversible oral disease that refers to gingival inflammation induced by bacterial biofilms, also called plaque, adherent to tooth surfaces. And there's another definition by the American Academy of Periodontology, which defines gingivitis as an inflammation confined to the tissues of the marginal gingiva. And here's an animated picture of gingivitis, and here's a more detailed picture by which we can differentiate easily a healthy gum to the diseased gum. We can see the healthy gum has a pink and smooth surface of gingiva, but on the inflamed one, there is red color and the surface is not smooth, rough, and there's also a periodontal pocket. Before going to discuss my other contents, I want to show you a data or survey which I have showed here. This is a survey on dental problems and awareness on dental health, which was done at Dhaka Dental College. And I'm showing you to know the importance of gingivitis in Bangladesh. And it was done about on 100 patients on the February 2017 to June 2017. And in this study, the most common dental problem was found gingivitis. It was found about 48% cases. And so we can understand it has lots of clinical importance in Bangladesh. Now coming to my next topic, which is the characteristics of gingiva, we will read about the color, contour, texture, consistency, and size of the gingiva. In case of gingivitis, these are the most important characters. In case of color, here's a healthy gingiva and here's a gingivitis. In case of healthy gingiva, the gingiva color remains pink or coral pink. But in case of gingivitis, this color changes into red. In case of more progressive inflammation, the red color transforms into bluish red and finally goes to deep blue. Then coming to contour, in case of the healthy gingiva, if we see the marginal gingiva, it appears sharp, and the interdental papilla also is sharp and pointed. But in case of gingivitis, the marginal gingiva appears more rounded and the interdental papilla is kind of blunted. Then coming to texture, in case of a healthy gingiva, here you can see there's a kind of stippling character. It is a kind of orange peel, and it is found in healthy gingiva. But in case of gingivitis, this stippling nature is reduced. Then coming to consistency, in case of healthy gingiva, it's always firm or hard. But in case of gingivitis, it becomes spongy or soft due to edema. Then coming to size, we can clearly see here the healthy gingiva from the healthy gingiva, the gingivitis here, the size has been increased or swollen due to edema. Some important characteristics are bleeding tendency. In case of gingivitis, there is a tendency of bleeding on probing or toothbrushing, and there may be calculus or plaque also present. And in case of gingival position, there may be gingival recession. Here we can see this was the normal margin of the gingiva, but it recessed to be up to this. Then coming to bone loss, there's no bone loss with gingivitis, and there may be increased sulcular depth or pocket depth. There may be increased salivation. There sometimes may be marginal ulceration, and there also may be sometimes halitosis. Now, coming to the classification of gingivitis, we can classify gingiva according to gingivitis according to two bases, according to course and according to distribution. According to course, we can classify into acute, recurrent, and chronic gingivitis. In case of acute gingivitis, from the name, we can already understand that its onset will be sudden, its duration will be short, and it could be painful. And from the name chronic, we already understand that its onset will be slow, its duration will be long, and it will be painless. And there's another gingivitis named recurrent gingivitis, which will recur obviously, and recur, that means it will reappear after eliminated by treatment or disappearing spontaneously. And there's another, I would say, subdivision of acute gingivitis, or which is a less severe form of acute condition, and we name it as subacute. Next, coming to the classification according to distribution. According to distribution, we can classify into localized and generalized gingivitis. And localized and generalized gingivitis both can be classified again into marginal gingivitis, papillary gingivitis, and diffuse gingivitis. From the name localized gingivitis, we already know it will be localized inflammation. That means it will be localized to a single tooth or a group of teeth. And generalized gingivitis, well, it will be generalized, it will involve the entire mouth. Now, coming to localized gingivitis, from the name marginal, papillary, and diffuse, we can understand from marginal, it will confine to the marginal gingiva of one or more areas of the tooth. And in case of papillary gingivitis, it will confine into the interdental spaces. And in case of diffuse gingivitis, it will cover the marginal gingiva, the attached gingiva, and also the interdental spaces. That means it extends from the margin to the mucobuccal fold in a limited area. If we see a picture, it will be more clear. more clear. In this picture, here we can see on the marginal gingiva, there's an inflammation, or here also an inflammation, or gingivitis. So it will be called localized marginal gingivitis. And if we see in this case, there is a gingivitis in the interdental papilla. So we will call it papillary gingivitis. And in case of this picture, we can see this is a localized diffuse gingivitis, as it covers the marginal gingiva, the interdental papilla, and also the attached gingiva of the surrounding areas. Now, coming to the generalized gingivitis, again, marginal, papillary, and diffuse, and the same goes for this also. Marginal would be on the gingival margins, papillary would be on the interdental papilla, and diffuse would be the entire surrounding area. But in this case, this will be in relation to all the teeth. All the teeth will be affected, or the entire gingiva will be affected.
Rashmee Apu, you have 2 minutes left.
Okay, thank you. Okay, in this picture, we can see on the marginal gingiva, there in the whole gingiva, on the marginal gingiva, there is gingivitis, or moreover, there are plaques. So it will be generalized marginal gingivitis. And in case of this picture, there are gingivitis on the interdental papillae in the entire mouth, which will be known as generalized papillary gingivitis. And this picture shows, this entire picture shows gingivitis. So it will be a diffuse gingivitis and generalized diffuse gingivitis. Well, I have sought my help mainly from Karansa, and I also took help from these two books. That's it. Thank you. Thank you so much for your patience. Thank you so much.
Thank you so much, Rashmee Apu, for your brilliant presentation. And now, can I please request our next participant, Nusrat, Jahan, Saima Apu from Chattagram International Dental College, session 17 and 18. Apu, I would like to request to take over the presentation.
Everyone there at the paper presentation program organized by Exist Dental School, Salamu Alaikum. My heartiest gratitude to all the judges, Professor Dr. Zakir Ahmed Shaheen sir, Professor Dr. Manoj Humagain sir, Professor Dr. Anupam Podder sir for giving their valuable time from their busy schedule. I would like to thank our moderator Naimur and Axis Dental School whole team for arranging such an innovative program for all the dentists and dental students throughout the Bangladesh. Besides, I would love to thank Dr. Anupam Podder sir for being a great mentor and instructing for all this. So welcome to my presentations. Myself, Nusrat Jahan Saima. Currently, I'm studying as third-year BD student at Chattagram International Dental College. My session is 2017-18. Today, our topic is chronic gingivitis. These are my provided contents: clinical features, etiology, dental plaque-induced gingivitis, which is divided into gingivitis associated with dental plaque, gingivitis associated with modified by systemic factors, gingivitis modified by medications, and gingivitis modified by malnutrition. Here we can see a healthy gingiva, coral pink in color, firm in consistency. Also, we can see orange peel appearance, which is called stippling. Let's move on to the main clinical features of the gingivitis. As we can see in the first picture, it starts as light redness, and in the second picture, it became bluish red in chronic stage. In both pictures, we can see there is reduction of stippling. Consistency is soft and spongy to firm. Size, there is severe inflammation which causes swollen gingiva. We can see in the second picture. Contour, there may be marginal gingiva appears rounded with blunted interdental papilla, and ulceration may be found. Also, we can see in this picture at this slide, bleeding on probing and toothbrushing. Usually, chronic stage, at chronic stage, it is painless and slowly growing. Inflammation of the gingiva without attachment and bone loss. Halitosis and foul smell from mouth can be seen. Etiology. There are two types of gingival disease. One is plaque-induced and another one is non-plaque induced. So my topic is dental plaque-induced gingivitis, which is divided into gingivitis associated with dental plaque, gingivitis associated with modified by systemic factors, gingivitis modified by medications. Look up three main points, which is gingivitis associated with modified by systemic factors. There I have mentioned two systems, which is associated with endocrine system and associated with blood. Associated with endocrine system, there's pregnancy associated, pregnancy gingivitis, and pyogenic granuloma. And another one is diabetes mellitus associated gingivitis. And associated with blood, there's leukemia associated gingival diseases. Second point is gingivitis modified by medications. There are many drugs like anticonvulsant drugs, immunosuppressive drugs, and calcium channel blockers, which influence gingival diseases. And last point is gingivitis modified by medications, which is vitamin C deficiency induced gingivitis. So moving towards the elaborations, first, I would like to elaborate gingivitis associated with dental plaque. Plaque-induced gingival disease, it is the result of an interactions between the microorganism found in the dental plaque biofilm. There are some microorganisms involved. These are Fusobacterium fusiformis, Prevotella intermedia, and Porphyromonas gingivalis. There are some local factors which modify plaque-induced gingivitis. These are tooth anatomical factors, dental restorations and appliances, root fractures, cervical root receptions, and cemental tears. So in this slide, we can see some tooth anatomical factors. In first slide, we can see crowding of the teeth. In second slide, we can see spacing. And third slide, we can see the malocclusion. These all causes gingival diseases. Other than that, poor lip seal, high labial frenum attachment, anatomical tooth abnormalities like macrodontia and macrodontia can be seen. In next slide, there are some other causes, which is dental restorations and appliances, overhanging margin due to improper restorations, inadequate technique, inadequate finishing and polishing can cause gingival diseases. And third one is root fracture. There is some parafunctional habit like bruxism, which causes gingival disease. Other than that, there may be physical trauma present. Cervical root receptions and cemental tears. There are traumatic occlusions, pressures from the tumor or cyst, or too much force during the orthodontic procedure, which causes gingival diseases. Now, I would like to describe gingivitis associated with modified by systemic factors. Pregnancy gingivitis. It usually occurs in the first trimester or second or third months of the pregnancy. As this picture shows, bright red gingiva, there may be swollen and interdental papilla, and this is edematous. Sometimes bleeding on probing can be seen. Now my topic is pyogenic granuloma. Pyogenic granuloma, it is a reactive hyperplasia of the connective tissue in response to local irritant, trauma, and hormonal imbalance. Clinical features. These are commonly seen in females, mainly found in the attached gingiva. In this picture, we can see it is red and relatively soft. There may be pedunculated and ulceration may be present. Microscopic feature. It consists of many dilated blood vessels in a loose edematous connective tissue stroma. There is some acute inflammatory infiltrations can be seen in scanty amount. From the endocrine part, there is diabetes mellitus associated gingivitis. In diabetes, marked inflammation affects both epithelial and connective tissue, which leads to the degeneration of the dermal papilla and increase the number of the inflammatory cells, causing accumulation of the dense collagen fibers. There are some features which associated with diabetes mellitus. These are enlarged large velvety gingival tissue and bleed easily. We can see in this picture enlarged red velvety. There may be some multiple abscesses, proliferation of the granulation tissue at the gingival margin, slow resolution of the gingivitis. Last point of my systemic factors is leukemia-associated gingivitis. Infiltration of the leukemic cells in the gingival corium, the normal connective tissue component of the gingiva displaced by the leukemic cells. Blood vessels are distended predominantly and reduce the number of red blood cells. Degeneration of the intercellular and intracellular edema. Increase the gingival thickness, formation of the gingival pocket, accumulation of the bacterial plaque, and final leukemic gingival disease occurs. In this picture, we can see the leukemic infiltrations causing localized gingival swelling of the interdental papilla. As I have mentioned before, there are many drugs which influence gingival diseases. So let's have a look how drug influence gingival diseases. Drug influenced by gingival disease.
2 minutes.
Enlargement consists of hyperplasia of the epithelial connective tissue. There is acanthosis of the epithelium, elongated retipex deep into the connective tissue. Drug stimulates the fibroblast cell and epithelium. Fibroblasts induce the gingival overgrowth by increasing synthesis of the sulfated glycosaminoglycans. Fibroblast to collagen ratio equal to the normal gingiva. Oxytocin fibers are numerous beneath the epithelium, and finally gingival hyperplasia occurs. In these two pictures, we can see gingival enlargement due to drug, and these inflammation and enlargement sometimes patient specific. My last point of the etiology is gingivitis modified by malnutrition, which is vitamin C deficiency gingivitis. Deficiency of vitamin C or ascorbic acid, which decrease the synthesis of the mucopolysaccharides, decrease the cellular binding, increase the exudation, increase the proliferation of the collagen, increase circular depth, difficulty in cleaning a tooth, and plaque accumulation occurs chronic gingivitis. In this picture, we can see bleeding from gum due to vitamin C deficiency. To sum up, before I finish, I would like to say that not only there are plaque-induced gingivitis, but also there may be other factors present which causes gingival diseases. So we must exclude the causes as soon as possible and early diagnose to treat gingival disease. Here are some references. I have taken Karanja's Clinical Periodontology, 11th edition, and Coulson's Essentials of Oral Pathology and Oral Medicine, 9th edition. Also, I've taken some information from internet too. Lastly, healthy gum leads to beautiful smile. So put on your best smile every day. Thank you so much.
Thank you so much, Nusrat, Jahan, Saima Apu, for your amazing one and finishing just on time. So finally, I would like to request our final presenter, Proma Ghosh Apu from Kumudini Women's Medical College, session 17 and 18. Apu, you may proceed now.
Triple judges, dear moderator, and distinguished viewers, Assalamu alaikum, and very good evening to you all. I'm Proma Ghosh, session 2017-18 from Kumudini Women's Medical College Dental Unit, one of the units of Kumudini Welfare Trust, founded by philanthropist Narada Prasad Shaha. High esteemed judges, my today's selected topic is chronic gingivitis. From this important topic, I will have to discuss about non-plaque induced gingival diseases and management of chronic gingivitis. Non-plaque induced gingival disease. First of all, we should know what is non-plaque induced gingival disease. Non-plaque induced gingival disease is an inflammation of the gingiva with an etiology other than dental plaque, such as gingival disease of specific bacterial, viral, fungal, genetic origin, or due to systemic condition, trauma, foreign body reactions, and other causes. Now, classification of non-plaque induced gingival diseases. According to etiology, type 1, gingival diseases of specific bacterial origin. There are two types of bacteria, Neisseria gonorrhoeae, Treponema pallidum, Streptococcus species. Type 2, gingival diseases of viral origin. Herpes virus infection that is responsible for primary herpetic gingivostomatitis, recurrent oral herpes, varicella zoster. Number 3, gingival disease of fungal origin. Candida species infection, generalized gingival candidiasis, linear gingival arrhythmia, histoplasmosis. Type 4, gingival lesion of genetic origin, hereditary gingival fibromatosis. Number 5, gingival manifestation of systemic condition. There are two types, mucocutaneous lesion and allergic reaction. Mucocutaneous lesion is caused by lichen planus, pemphigoid, pemphigus, erythema multiforme, lupus erythematosus, drug-induced condition. Allergic reaction is caused by dental restorative materials, mercury, nickel, acrylic, reacting attributable to the following: toothpaste or dentifrice, mouth rinse or mouthwash, chewing gum additives, foods and additives. Number 6, traumatic lesion, chemical injury, physical injury, and thermal injury. And last of all, foreign body reaction. Now, I'd like to present some diseases. Gingival disease of specific bacterial origin, Streptococcal gingivitis or gingivostomatitis. It is a rare entity that may present as an acute condition with fever, malaise, and pain associated with acutely inflamed, diffuse, red, and swollen gingiva with increased bleeding and occasional gingival abscess formation. The gingival infection are usually preceded by tonsillitis, and they have been associated with group A beta hemolytic streptococcal infection. Here, we can see a picture of streptococcal gingivitis. In this picture, we can see there is a swollen, red, and diffuse gingiva. Now, I'd like to go to the next slide. Gingival disease of viral origin. The most common disease is primary herpetic gingivostomatitis, which is caused by herpes simplex type 1 virus. Clinically, they present as multiple tiny vesicles that progress to form painful ulcer, painful erythematous swollen gingiva, fever, malaise, cervical lymphadenopathy. It occurs mainly in children younger than 6 years, but may also be seen in adults and teenagers. Duration of course, 10 to 14 days. Here is a picture of primary herpetic gingivostomatitis. We can see some lesions in the tongue. Now, gingival disease of fungal origin. The most common fungal infection of oral mucosa is candidiasis. It is also known as thrush. It is an infection of the mucosa membrane of the mouth due to candida, especially Candida albicans. Oral mucus causes the creamy white lesion, usually on the tongue or inner cheeks. Sometimes, oral thrush may spread to the roof of the mouth, gums, or tonsillitis, or the back of the throat. Here is a picture of oral candidiasis. We can see the white creamy lesion on the tongue and roof of the mouth. Now, I would like to go next slide. Gingival disease of genetic origin. One of the most clinically evident condition is hereditary gingival fibromatosis. It has an autosomal dominant or rarely autosomal recessive mode of inheritance. It is characterized by slow, progressive enlargement of the gingiva. The gingival enlargement may completely cover the tooth and delay the eruption. Here is a picture of hereditary gingival fibromatosis. We can see the enlargement of the gingiva, it almost covering the tooth. Now, I'd like to present my second topic, management of chronic gingivitis. Treatment. Phase 1, conservative and surgical. Patient education and oral hygiene instruction, effective toothbrushing, interdental cleaning habits, root planing, removal of the supra and subgingival calculus by scaling and polishing. There is the picture of subgingival calculus and it is the picture of supragingival calculus. Now I would like to go next. Phase 2, evaluation of response to phase therapy by rechecking, gingival inflammation, plaque and calculus, treatment of carious lesion, contribution to the plaque accumulation. Phase 3, maintenance. Recall visit 3 weeks, 6 weeks, 3 months, 6 months, and onward twice a year based on a plaque accumulation and patient cooperation to check the patient whether patient maintained the hygiene or not. Now, I would like to go last slide. Prevention of chronic gingivitis, elimination of etiological factors, maintenance of plaque control consistent with gingival healing, effective removal of supragingival and subgingival calculus, placement of dental and prosthetic restoration, intake of nutritionally adequate diet with reduction of refined sugar, performance of orthodontics when indicated. Here is my references. Honorable judges, that's all about my today's selected topic. I'm immensely happy and delighted to be here and have the opportunity to offer my presentation before all the distinguished personalities. Thank you all of you for arranging such an amazing competition. Thank you so much, sir.
Thank you so much, Proma Apu, for this excellent presentation, and thanks all of our participants for your delightful performance. So, hearing all the presenters' presentation, I myself become fascinated with your performance. Hope the audience and our judges love all the participants' presentation. So now, I would like to request our honorable judges to take minutes and discuss all the presentation and let us know about any question that you have for the participants. Firstly, I would like to request our Honorable Professor Dr. Zakir Ahmed Shaheen, sir. Sir, please share your opinion with us.
That is now we can ask the question.
Sir, please.
Moderator.
Yes, sir, please.
Okay. Okay, if gingivitis, first presenter Rashmee, Dhaka Dental College. Can you answer me? If gingivitis occurs, then what we can do? What you can do to remove the gingivitis? Rashmee, can you hear me?
Sorry, sir, I was muted. Okay.
Okay. Now again I told you, if there is a gingivitis occur, what we can do to remove the gingivitis?
So at first I will try in non-surgical way or conservative or
Your net is disturbing. We cannot hear.
way. Then like I will tell the patient to sir, can you hear me?
No, but bhanga tomar internet connection mane disturbing.
Sorry, sir, maybe.
Okay, you can answer your question.
Sir, at first I will go for non-surgical treatment. Then I will go for effective toothbrushing and then cleaning. Yes, sir.
Okay, if there is a chronic gingivitis,
then I will go for treatment like surgical treatment. Hello?
Surgical treatment means what?
Hello.
আমার
কথাটা actually কেটে কেটে আসছে।
তোমার তো কথা প্রথম থেকেই কেটে কেটে আসতেছিল। শোনা যাচ্ছে? Okay, no problem. No problem. My next question to Reshma, Chittagong Dental Unit.
Sir, can you hear me? Hello.
ভাঙ্গা ভাঙ্গা
Sorry,
তোমারটা
sir.
ভাঙ্গা
My
ভাঙ্গা
net was
ভাঙ্গা
disturbing.
আমরা ক্লিয়ার না,
Yeah.
ভাঙ্গা ভাঙ্গা আসতেছে তো কি বোঝা যাচ্ছে না। অন্যরা বুঝতে পারছো?
Sir, I will.
যারা তো মডারেটর আছো?
স্যার
হ্যাঁ, একদম বুঝতে পারছো ওর কথা? আমরা তো বুঝতে পারছি না।
স্যার একটু প্রবলেম হচ্ছিল মাঝে মাঝে।
Sir,
হ্যাঁ
our internet connection বারবার unstable আসছে আর কি। Sorry, sir.
হ্যাঁ
Okay.
Sir, I will
Okay.
do non-surgical treatment. Like I will at first remove the etiological cause. That means if there is plaque, I'll do plaque removal, or হচ্ছে গিয়ে then I'll do restoration.
you will do restoration. Why? There is no restoration, but gingivitis will occur. In that case, you will give that management treatment. শোনা যাচ্ছে না?
Sir,
আচ্ছা,
prosthetic.
আমরা প্রস্থেটিক রেজিস্ট্রেশন নাই, বাট জিঞ্জিভাইটিস, ক্রনিক জিঞ্জিভাইটিস, তাহলে আমরা সেখানে কি করব? আমরা সার্জারিতে করব না?
না স্যার।
সার্জারি কখন করব? জিঞ্জিভাইটিস, ক্রনিক জিঞ্জিভাইটিস হলেই কি আমরা সার্জারি করে দেব? সার্জারি কখন করব?
Sir, when there is chronic gingivitis and after non-surgical treatment, মানে তারপরও যদি occur করে after non-surgical treatment করার পরেও যদি থাকে।
Okay. My next question to Rashma, Chittagong Dental Unit.
Sir, Assalamualaikum.
Can you hear me?
Yes, sir, I can hear you.
Okay, if a patient comes to you with the gingivitis, bleeding the gum, then how we can treat the patient?
Sir, in case of gingivitis, firstly we will tell the patient to maintain oral hygiene. More frequent cleansing of the tooth. We can suggest some mouthwash like chlorhexidine. Then we can.
Now, this is the advice. This is the advice to the patient. First, but gingivitis patient come to you. Now
Yes,
we
sir.
can manage it. Gingivitis holei je
Yes, sir, we can. Sir, we can do scaling in case of
right.
non-surgical, both supragingivally and subgingivally. We can do scaling.
Then give the advice, right?
Then I will give the instructions to the patients.
This is the way. This is the technique.
Yes.
Okay. Next gingivitis plug induced next year. Proma Ghosh, Kumudini Medical Dental Unit. Can you hear me?
Yes, sir, I can hear you.
Plug induced gingivitis. Now, what is your advice to the what advice you will give to the patient? Your advice to the patient?
Yes, sir. At first, it's sir, non-surgical advice দেবো, oral hygiene maintain করার জন্য, toothbrushing properly করার জন্য বলবো। Then surgery.
How much time they will brushing the tooth?
Sir, 2 times it.
Two times. Okay. Each time how minutes? 1 hour or 2 hours?
So each time 2 minutes.
2 minutes, right? 2 to 4 minutes before bed and after breakfast, right? This is the accurate. You always give the patient this type of advice before bed and after breakfast, 2 to 4 minutes.
Yes.
And this is the ideal technique of brush and brushing technique. You know?
Sir.
How brush the teeth in case of upper posterior teeth?
Sir, upwards to downwards.
Upwards to downwards. It's a big term, but in case of upper, I give you a specific question. In case of upper, then brush from where to where, labial surface. How you will brushing the tooth? Labial surface only.
Sir, on the labial surface, so from up, get up and down, Sir, can I say in Bengali?
Okay, you can understand any language.
Sir, in the toothbrush, sir, brush আমরা হচ্ছে 3 tooth একসঙ্গে মানে উপর থেকে নিচে স্যার ব্রাশ করব লেভিয়ালি,
রাইট?
মানে
উপর থেকে নিচে, হ্যাঁ। In case of lower teeth,
স্যার নিচ থেকে উপরের দিকে,
নিচ থেকে উপরের দিকে, এভাবে অ্যাডভাইস পেশেন্টকে অ্যাডভাইস করতে হবে, তাইলে আমাদের জিঞ্জিভাইটিস প্লাক ইনডিউস জিঞ্জিভাইটিস আর তৈরি হবে না। এবং জিঞ্জিভাইটিস যাতে না হয় এই জন্য আমরা কি করতে বলি? আর শুধু একটা ব্রাশিং, নেক্সট
স্যার মাউথ ওয়াশ, হ্যাঁ, ইয়েস,
মাউথ ওয়াশ
yes sir.
which one mouthwash is best?
Sir, chlorhexidine mouthwash.
Chlorhexidine mouthwash. And scaling time. Can you tell me the scaling time of each individual patient? Every year or every 6 months? Scaling time?
Sir,
and আমরা সবসময় বলে
3 months.
5 মাস? 3 months না, আমরা তো 6 months পর আমরা বলে রাখি যে 6 months পর আপনি স্কেলিং করে নেবেন, তাহলে জিঞ্জিভাইটিস আর ডেভেলপ করবে না, ঠিক না?
জি স্যার।
Okay, that's all the question, moderator.
Thank you, sir.
Thank you so much, sir, for your question and amicable advice. And now I would like to request our foreign judge, Dr. Manoj Humagain, sir. Sir, please share your point of view and let all the participants know about if you have any question. Dr. Manoj, sir.
Thank you, Naimur. First, I'll go through a few questions to each participant, and at the end, I will give my viewpoints. I think, is that okay?
Dr. Manoj.
Yes, sir.
Dr. Manoj, if you in discussion, if you that is a discussion, any question answer, if you mind that this answer is not clear, then you discuss the way.
Yeah, I will tell the answer as well. When the answer from the participant is not very clear, I will elaborate it. First question goes to Dr. Rashmee from DDC.
Yes, sir.
Okay. You talk about the different characteristic feature of the healthy gingiva.
Yes,
You
sir.
talk about steepling, surface texture, and
Yes, sir.
steepling. Okay, on which part of the gingiva do you look for steepling?
So on the exterior surface.
No, in the gingiva we have 3 parts: the marginal gingiva, the attached gingiva,
sir,
and the interdental papilla. Okay.
Yes, sir. On
Where do you
the
look?
sir, marginal gingiva doesn't have any stapling. Only the attached gingiva and the interdental papillae has the stapling.
Very good. On the center of interdental papilla and attached gingiva, can you elaborate why it is so? Why it is absent in marginal gingiva?
No, sir.
Okay.
Sorry.
We have 2 types of fibers in gingiva. We have a papillary fibers. We have the reticular fibers. Okay. The papillary fibers are the fibers which are projecting towards the surface epithelium. The reticular fibers are those fibers which are attached to the underlying periosteum. Okay. So the papillary fiber, projecting fiber, it forms the elevations on the surface of the gingiva, and the reticular fibers, which are attached to the underlying periosteum, it has pulling effect on the gingiva that makes depressions on the surface of the gingiva. And that alternate protuberance and depressions on the surface of the gingiva gives it an orange peel-like appearance, and that is known as steepling. Okay, and it is a characteristic feature of healthy gingiva. Whenever there is an inflammation, whenever there is an edema into this gingival connective tissue, then there will be loss of steepling. Steepling loss, one condition in case of gingival inflammation. Another condition, in case of late adulthood, it will lost. In early infancy, it will be lost. And in the site-specific variations, like it is more prominent in the anterior tooth as compared to the posterior tooth. And sometimes it has a individual variations, like it can be more prominent on me, it can be less prominent in another individual. So these are the 5 different conditions where you have different variations of stippling. But stippling is exaggerated. It is more prominent in case of fibrotic gingival enlargement. Have you come across with the new classification? All the classification you have presented, it was the American Academy of Periodontology 1999 classification. That was a standard classification till 2017. Okay, the World Workshop of Periodontics has given a new classification in 2017. So it is not there in the standard textbook 8, but I suggest you to go through it. It is more elaborate, particularly when to say localized gingivitis and when to say it is a generalized gingivitis. It has a clear-cut distinction with the percentage of sites with the bleeding and probing. Previously, we used to say if only 1-2 therapy, only one site is involved, it is localized. If more than one site is involved, it is generalized. But that has become changed with the percentage sites of the bleeding and probing. If it is less than 10%, it is considered as localized. If it is more than 10% of the sites with bleeding and probing, it is considered as a generalized. You rightly discussed about the diffused gingivitis. Can you give me one example in which condition the diffused gingivitis may be present?
Please unmute, Faiza. Please unmute. Rashmee, please unmute.
Rashmee নেটের সমস্যা বোধ হয়।
Sir, hello.
Yes.
Sir, diffuse gingiva is mainly the inflammation of the whole. In case of sir chronic gingivitis.
No, chronic gingivitis, basically it is almost more than 90% it is generalized marginal gingivitis. It can have a additional papillary gingivitis, but diffuse, it involves marginal, papillary, as well as attached gingiva. All the components are involved. That is very, very, very rare. Only in a patient with systemic disease and conditions, they can have a diffuse gingivitis. Okay. Thank you, Rashmee. I will move to Nusrat Jahan from Chattagram Dental College.
Thank you.
Sir, sir.
Yes. Assalamu alaikum. Regarding, you said about the color changes on the gingiva, right? It can be red, it can be the pink, then later it can be pale pink, and if it goes into the chronic state, it will be bluish or deep blue in color. Okay, but can you tell me what are the factors that will determine the color of the gingiva in normal health? The factors that determines the color of the gingiva in normal health.
Sir, in
normal health. You say it is a coral pink.
Sir.
So what are the factors? Sir. Based on what factors it is coral pink in color?
Sorry, sir.
Okay,
I have
no worries.
network.
Basically,
there may be vascular supply and the supply which leads to the color. Also, there may be thickness, thickness of the epithelium, which
very good. Yes.
Which one of the factors, and sir, there may be a degree of keratinization, which
absolutely fine.
Which are one of the factors, and there may be present some pigmentation physiologically.
Yes. Yes, that is what is the answer. Those 4 points were the answer. So in gingivitis, we say bleeding and probing will be present.
Yes, sir.
Okay. So from where does this blood comes? While probing into the sulcus, we run the probe into the sulcus, there will be bleeding whenever there is a gingivitis. From where does this bleeding occurs?
Sir, in case of healthy gingiva, it is firm. Sir, in case of healthy gingiva, the consistency is soft, and in disease state, their contour may be lost. So these results to the bleeding on probing.
Okay, but I will give you the idea, anatomy of the gingival sulcus. One side we have the tooth, either enamel or cementum. And I believe both the structures are avascular. There is no bleeding from enamel. There is no bleeding from cementum. In another side, we have the sulcular epithelium, and apically we have the junctional epithelium. And I believe the epithelium also is avascular. It does not have any blood supply. But when we run the probe into this anatomical structure, bleeding will occur in gingivitis. From where do you think this bleeding occurs? That is my question.
So may I interrupt?
Okay.
Okay.
So is it the ulceration or inflammation of the gingiva? Ulceration of the gingival lining?
Yes, there is a ulceration in the sulcular epithelium. Only from the ulceration in the sulcular epithelium, and there is a inflammation in the gingival connective tissue, which leads into the engorgement of the blood vessels just below the sulcular epithelium. That causes the bleeding, and that is the main cardinal sign of gingivitis. So how do you distinguish gingivitis from periodontitis? Again, a question to Nusrat, Jahan. How do you distinguish gingivitis and periodontitis?
So difference between gingivitis and periodontitis.
Only based on your clinical finding, if you clinically examine, how do you distinguish whether it is a gingivitis?
Sir, we can distinguish by probing, and there may be presence or there may be buildup of plaque at the gum line, and we can distinguish the gingivitis and periodontitis in
okay.
Sir,
Very
bone
easy.
loss. Sir, by watching the bone loss.
Bone loss clinically we cannot see. Only when we take radiograph, then only we can have evidence of bone loss. By seeing with our eye, we cannot say there is bone loss. Okay? There is some other parameters to check for
Sir,
it.
probing is there is generally painful in case of probing there may be painful in.
But in case of gingivitis, also there can be painful probing. In case of periodontitis, also there can be.
There may be past presence in
Past
case.
Is it is a feature, exudates or past present. It is a feature of disease activity, but it is not a feature of disease category. In gingivitis also there can be past. In periodontitis also there can be past.
Sir, in case of periodontitis, probing depth is higher. Also, tooth mobility we can see tooth mobility in case of periodontitis, but gingivitis we cannot see that.
Okay, one is the tooth mobility. I agree. Apart from that,
sir, I don't remember right now. So.
There is a clinical attachment.
In case of sir, gingival wall may be firm, but in case of periodontitis, we don't see anything like this.
No. Basically, we look for the clinical attachment loss. Okay. In case of gingival inflammation, only gingiva is involved. Whenever there is a periodontal ligament and alveolar bone or cementum is involved, we say it is a periodontitis. For those structures to be involved, there must be clinical attachment loss, and that is the main characteristic feature. Apart from that, we have a mobility, we have the furcation involvement, all those things also we look for.
Which discolorations can see with gingivitis, but periodontitis we cannot see like this discolorations of.
Okay, my question goes to Proma Ghosh from Kumudini Medical College Dental Unit.
Yes, sir. Good evening, sir.
Yeah, you have talked about non-plaque induced gingivitis and management of the gingivitis.
Yes, sir.
Have you come across a term Bartholin line?
Jesus, sorry.
The bluish linear line along the margin of the gingiva. Have you come across? It is given in the Carenza as you have referred it. Bartholin line. It is a sort of metal toxicity where there is a bluish discoloration of the gingiva is present. And I would ask you one question. How will you distinguish between, is it a drug-induced gingival enlargement or it is a hereditary gingival fibromatosis or idiopathic gingival enlargement? Okay, how will you distinguish? Is it a drug-induced or is it a hereditary gingival fibromatosis or idiopathic gingival enlargement?
So here, gingival fibromatosis. Sorry, sir. Hereditary gingival fibromatosis. Sir, sorry, I didn't get that question.
Okay, I would say a patient comes to you with a massive gingival enlargement. Okay, almost 2/3 of the crown is covered with a enlarged gingiva. Okay, by seeing patient's mouth only without asking a single question, you can distinguish whether it is a drug-induced or it is a hereditary. What is that characteristic feature? Okay, maybe a bit tough question to you, I know. It is that in case of drug-induced, calls only marginal and interdental papilla. Okay, whereas in case of hereditary gingival enlargement, it is diffuse type of gingival enlargement. All the parts of the gingiva is involved. That is the main point to be considered. Apart from that, you can take the history of drug intakes, any family history present or not, other things you can take. What is drug-induced gingivitis? What is drug-influenced gingivitis? Induced and influenced. There are two terms. Okay. Yes. So certain drugs causes drug-induced gingival enlargement or gingivitis. Certain drugs are there which causes drug-influenced. Can you tell me the difference between these two terms and can you give me the example?
Sir, drug-induced.
Okay, certain drugs are there which causes the proliferation of the fibroblast that causes the excessive collagen formation, excessive fibrosis of the gingiva. Drug influenced are those type of drug which influences the gingival inflammation there, like they causes the hormonal changes. The most important example of drug influenced gingivitis is the oral contraceptive pills. The hormones that are being used causes the gingival inflammation. Okay, thank you very much. Thank you all the participants. I'm very happy to see the progress of periodontology in Bangladesh. I remember the date back 1998, 1999 when I was BDS third year student at Dhaka Dental College. At that time, Professor Jorda sir was my teacher. He used to teach all these things in detail, but I couldn't catch anything else because our level of knowledge was not that good to catch up. And having this subject at BDS third year is really a big challenge. It should have been in a final year so that you can have an integrated knowledge of all the subjects. It is very interesting subject indeed. And all of you three have really worked very hard to make this topic very interesting. Thank you, Anupam Da, for making this sort of program. This sort of program really will enhance the knowledge of periodontology in Bangladesh. I have few suggestions, like in this topic, few of the things are missed out. like stages of gingivitis is very, very important aspect, like the early lesion, initial lesion, uh, established lesion, and advanced lesion. It has been categorized. All those, what are the clinical changes occurs, what are the histopathological features that occurs. Everything is very, very important for undergraduate level. You could have added that thing. All the other things are there as almost covered. And in the treatment part, uh, it is basically gingivitis is treated only with the non-surgical therapy. When it has a very chronic course and when there is a fibrotic changes, then only we go for surgical, and that is gingivectomy. Otherwise, it is with the non-surgical only, and it is purely with the etiology removal, that is the plaque and calculus. It has to be removed. Okay, basically it is the plaque induced. We talk other non-plaque induced conditions, they are only the modifier of the conditions. Ultimately the plaque has to come there, and plaque has to play the role to cause the gingivitis. So the main goal of our therapy is the removal of etiology, that is the control of the plaque and removal of the calculus. Calculus per se is not the etiology, but calculus always remained covered by soft plaque. That plaque harbors microorganism, and that microorganism causes the inflammatory changes in the gingiva, and ultimately that is the gingivitis. So this plaque and calculus are the main culprit for this gingiva, and if we remove that, it will reverse back into healthy state. That's why it is a reversible change. This much for today. Thank you very much. It is a very interesting session indeed. Thank you.
Thank you so much, sir, for sharing your life and suggestion. This will be a very image for youngster like us. I hope we all follow your every suggestions. Thank you again. And I hope our competitive are very confident with their answer. And finally, I would like to request our favorite, very renowned teacher, very close to our existential school. He's like the umbrella when rain with thunderbolt. Dr. Anupam Podder, sir, please, could you please share your perception with the competitors, with the audience, sir?
Thank you, Naimur, for your wonderful moderation. I am very happy to see our another foreign guest, Professor Dr. Balaji Manohar. He is now with us, and Dr. Manoj Humagain and Dr. Professor
Sir,
Dr.
I'm
Zakir
going
Ahmed
to
Shaheen.
introduce him after your speech.
Okay. I am very happy to see Balaji Manohar. We are. This is the time of appropriate time of discussion of chronic gingivitis. I think Dr. Balaji Manohar hand raised several times. He will discuss later when I complete my question and answer session. Then Balaji Manohar and Manoj Humagain, you also discuss the what are the if any fault by if any discussion that not occur, you may discuss. Okay, I have my question is all three presenters in same time. If any can answer, please raise your hands. First of all, how you make a proper diagnosis of chronic gingivitis? How you make a proper diagnosis of gingivitis? How you make a proper diagnosis of gingivitis?
Sir, by watching or by after examining?
Sir, first we have to exclude the sign and symptoms.
Sir, if we see if we see the color, from the color we can already understand there is some inflammation, and there we will see then some other characteristics like the reduced stippling, then color contour of the gingiva, the texture, then bleeding on probing, then So then we will go for radiography, and if there's no bone loss, then so that would be the confirmatory.
Sir, I want to add some. There we can measuring the gum. We can take X-ray, and later we can do the examinations, and we can do probing. Also, we can do inspections to diagnose the gingivitis.
So we can see the pocket depth. We can also measure the pocket depth. We see the inflammation, tenderness.
I think Dr. Balaji Manohar and Manoj Humagain, you discuss later
Sir, we
about
can
this.
do a
but-
sensitivity
but
test by
Yes,
ear blowing.
I think first of all, this is the acute gingivitis, not chronic gingivitis. This is the time being. The time is the main. First of all, you mentioned the time. When it is acute, this is the short period of time, and when it is chronic, this is the long period of time. This is the plaque induced is the chronic. Then you are going to it is localized, not generalized. When it is involved, according to American Academy of Periodontology, in 1999 classification says the 30% of areas you need to involve, and this is called the localized. Within the 30% of area involved, then this is called localized. If it is more than 30% area is involved, then this is called generalized. Then you are coming to the structure involvement. This is the marginal. This is the only margin. Now, this is only papillary. Now it is the diffuse, that is attached gingivitis involvement. This is the marginal, maybe papillary, maybe diffuse. And
Yes, sir,
it
we can
also
do inspection.
it also classified again. This is the plaque induced or non-plaque induced.
Or
So
non-
you may diagnose a case of gingivitis just like this. This is the chronic, localized, marginal plaque-induced gingivitis, or chronic, generalized, diffuse plaque-induced gingivitis. So when you classified, you mentioned the timing, also the area involvement, or the structure involvement, and also this is the plaque induced or non-plaque induced. This is the ideal method, maybe with the proper diagnosis of the gingivitis. I think in later Dr. Balaji Manohar and Manoj Humagain also discussed about this. Now I have another question. They have any pocket in the gingivitis?
Yes, sir. There may be.
Yes, sir.
Yes,
There
sir. There may be a
in
pocket.
circular depth, and there may be a periodontal
Depth.
pocket.
Yes, sir.
There may be pocket in the chronic gingivitis. There may be a pocket in the chronic gingivitis.
Yes, sir.
Yes, sir.
How?
Sir, no,
A pseudo pocket,
there-
sir.
Sir, there may be the
Pseudo
circular depth may be increased,
Absent.
and thus it will be a pseudo pocket.
There is no pocket
Pseudo
in
pocket,
chronic
sir.
gingivitis.
Yes, thank you. This is maybe when the gingival growth, any type of gingival growth, gingival hyperplasia,
It's a pseudo pocket.
there may be causes the pocket, but the pocket measure from the gingival margin. Oh, that means when the gum is enlarged, that may be a form of a pocket. This is the pseudo pocket, and when the bone loss, that is then form the true pocket, that is periodontitis, but no true pocket in the gingivitis. True pocket in the gingivitis. There may be a pseudo pocket in the chronic gingivitis when the gingival enlargement occurs. Okay, I have another question. What are the instruments used for supragingival calculus and subgingival calculus?
Sir, periodontal probe.
What are the instruments used for removal of calculus, supragingival calculus and subgingival calculus?
Scalar.
Sir,
What are the manual? What are the manual instruments used for the supragingival calculus and subgingival calculus?
Periodontal probe usually we use, but
Sir,
for
we can
removal or
use
for
probe.
diagnose.
Sir, we can use probe and we can use scaler, which is ultrasonic. Also, there are some manual scaler
Manual
too to remove the plaque and calculus.
Name of the instrument, calculus. What is the scalar? Name of scalar. What is the name of the scalar? Manual scalar. Name of manual scalar.
Oh, okay, sir. Sir,
Okay.
sir, ultrasonic scaler.
No manual, no ultrasonic. I say the manual scalar. Sorry, thank you. I have another question for you. What are the normal contour of the gingiva? What are the normal contour?
Sir, the marginal gingiva will be sharp and the interdental papilla will be sharp and pointed.
Normal, what is the term in the normal contour of the gingiva? What are the terms, the specific term? What is the shape of the contour of the gingiva? Shape.
Sir, scallop shape.
Scallop shape. So what is modified in the gingivitis? What is the modification of gingivitis? When gingivitis occurs, the scallop shape going to the
The marginal gingiva
turn to the scallop shape change to the
blunted.
Sir, if papilla, sir, if the papilla is pyramidal in shape and the attached gingiva which is firm, actually.
is the scallop shape maybe going to the
interdental papilla becomes blunt.
Yes, blunt, maybe flattened, maybe rounded. You already discussed, maybe Rashmee discussed about this.
Sir, when it became diseased, when it became diseased state, the gingiva became blunt.
Maybe ulceration, maybe rounded. In case of gingival recession, it is going to the rounded.
Yes.
Okay, thank you. Now we discussion the time of discussion, and discussion is made by Dr. Balaji Manohan, Dr. Manoj Humagain.
Thank you so much. Thank you for your amicable perception. And now it is my utmost pleasure to announce that we have another renowned foreign teacher with us today. He is none other than Honorable Dr. Balaji Manohar Sir, Principal Department of Periodontology from Kalinga Institute of Dental Science, Bhubaneswar, India. Thank you so much, sir. Thank you so much for joining with us. Sir, could you please share your perception with us?
Good evening, everyone. It is a pleasure to be present here. And first of all, I will thank Dr. Anupam, who is taking periodontology to the next level in Bangladesh. Congratulations, sir. I just came in today to just see the presentations being made by the students. I believe they are all third BDS students, and they are taking a lot of effort to do the presentations and drive home the point of periodontology into the audience, as well as their batchmates or students who are studying with them. I think today's moderation session is being done by Manoj. I will give Dr. Manoj the entire opportunity to do the moderation. But I've been hearing Dr. Manoj has covered a few points which the students forgot to mention. I'm not telling it is an oversight. Probably they just forgot to mention those things what Dr. Manoj has said. So I will first ask Dr. Manoj to give his views because he is the moderator. Dr. Manoj.
Thank you, Balaji, a good friend of mine always. Uh, Many a times we share the forums together. Like twice we were in body program as well. And then my viewpoint are almost been covered during question and answer session. I'm very happy to see the undergraduate third year students at this level. Definitely it will rise up. For that, Dr. Anupam is taking a good lead and it has to be continued. At least perio as a separate subject should be established in Bangladesh. It should not be clubbed with oral medicine. It should not be clubbed with oral pathology. Periodontology is a vast subject in itself. It is a huge subject. If we go on talking about gingivitis only, it takes at least 3-4 lectures. It is that fast. Okay. So in this gingivitis, right from the first to know what is disease, a student should have a very clear-cut idea what is health, what are the characteristics of gingival health, and what are the different deviations from this health, what are the etiology for that deviation from health to disease. If once student understood those things, then they will understand everything. So basic knowledge of the gingiva, the histopathological features, histological features, the anatomical structures, everything once you know the etiology, then what are the changes, histopathological changes that occurs and how does it manifest clinically? If you understand this, everything will be understood in a sequence. So this science has a sequential progression from health to disease. Okay, so you should learn in that way, I think, the undergraduate students. So first chapter, gingiva, everything, what are the different parts of the gingiva, what is gingival sulcus, what is normal depth of gingival sulcus, what are the different epitheliums present in it, what are the different connective tissues present in it, what are the different cells present in it, what is the blood supply of this gingiva, what are the size, shape of the gingiva, color of the gingiva, contour of the gingiva, then the position of the gingiva, the surface texture of the gingiva, bleeding and probing, exudates. These 8 characteristics we look for gingiva, what are there in health, what are the changes that occurs in disease. If you compare in this way, and at the same time, what are the different stages for this progression that which have been missed by the presenters, I said earlier, go through the chapter, it is clearly given, there is a table given with each histopathological changes, with the clinical changes, what occurs in each stages, it's given in the carenza itself. And then at the end, how to manage it, how to treat it. If you go through this, please try to read and understand periodontology subject as an essay. Do not try to mug up, try to understand the thing and try to correlate it, then you will understand everything. Otherwise, perio is a very top subject, but if you have an interest in it, into this subject, and if you try to remember it, recapitulate it with in an interesting way, you will never forget the science of periodontology, and that is what is very, very important. This is what I have to say, not much, because if we keep on saying, being a postgraduate teachers, if we pouring our knowledge into the head of these undergraduates, the budding dentists, I think it will overflow through their head, and I don't want to do that also. But I just want to motivate you. It's a very thumbs up, excellent presentation from your part. I'm very happy, and my comments and my suggestions have just add on into it. Please do not take it as a criticism. It's just an add on into your level of knowledge, and I hope that will enhance your knowledge in the subject of periodontology in a newer height. Thank you very much.
Thank you, Manoj sir. The way you direct us, I think there shouldn't be any confusion for our participant, and that will drive our future participant to make their presentation in front of us. Now, I would like to request our honorable foreign teacher, Dr. Balaji Manohar sir. Sir, please could you share something with us?
Thank you, Dr. Naimur. I totally agree with Dr. Manoj, whatever he has said. It is very important to know what is normal, then only you can differentiate it from the abnormal. So that is why if you see the textbook also, Actually, all the points what I wanted to say, Dr. Manoj has told about the color, contour, texture, everything he has covered. So these are the features which we have to really look into so that we are able to differentiate what difference is there when the person is coming with the disease. That is the first and foremost thing. All of you described all these things very nicely. All three presenters were talking about these things. But in the management part, you all little bit, I agree, you are all third BDS students, you are still learning, but the management part is something which you all have to look into. Yeah, Anupam sir also asked you about instruments that have to be used. So you have to little bit concentrate more because treatment aspect is very important for you as a dentist when you're going to practice. So what instrument should be used, where it should be used. Supragingival means we can use the scaler, subgingival calculus means curate we have to use. These things are very important. Secondly, we all know gingivitis is basically most commonly plaque induced it is. So calculus also over a period of time maturation is taking place and it hardens, so it becomes calculus. So plaque control also is a very important factor. So you have to educate the patient regarding how to do the proper brushing technique. What are the techniques you have to use for brushing? Not only that, we know that plaque first starts accumulating in the interdental region. So whether in those regions the toothbrush is not able to reach. So is there anything extra we can do for the patient, whether the interdental aids can be used, whether interdental brush or floss, these things have to be used for the patient so that the plaque control can be done. So these areas you have to little bit give more emphasis. When you start reading the treatment, it will become more interesting because this is what you are going to practice in your clinic. So it will be more interesting for you to read. But before you go into the treatment part, the basics is very important. Health and how it progresses to disease, and then from disease, how you are going to treat. So these three steps, one by one, we have to climb these steps. So it becomes very important. And students have to understand, all three of you are presenting, not only you three, everybody has to understand all three. When diagnosis of gingivitis was being discussed, everybody was talking about radiograph, we were telling. First, we have to do clinical examination. After clinical examination, radiography is an adjunct which you are using. First, clinical examination, you are okay. Any case, usually in gingivitis, you will not see any radiographic changes. But when you are probing, you see there is a pocket, you feel pocket is present, it is crossing 5 millimeter, 6 millimeter. You take an intraoral radiograph and check whether there is a loss of bone seen there or not. So these are some suggestions I wanted to tell you. But overall, it was nice presentation. I enjoyed it. And especially I feel when I was doing BDS, if someone like Dr. Anupam was there, who was holding the mashal of periodontology, I think I would have been more better than what I am today. Thank you. Thank you.
Thank you so much. Thank you, Dr. Balaji Manohar, sir, for your valuable suggestion and perception to share with us. We are really grateful to have you here today. Thank you so much, sir.
Thank you. Thank you.
And thank you so much to all of our respected teachers, and again the participants and our audience to being a part of this episode today. Dear judges, now I would like to mention the time that has been taken our participants for their presentation. First of all, Farhan Rashmee Apu, she is completed her presentation within 8 minutes and 4 seconds. About Nusrat Jahan Saima Apu, she has completed her presentation within 9 minutes and 16 seconds. And about the Proma Ghosh Apu, it is about 8 minutes and 25 seconds. I think this will help the judges to make the results. With very sorrow, I would like to share an information with you that one of our presenters today, Nusrat Jahan Saima Apu, is suffering from the pandemic we are suffering, that is COVID-19. Yes, she is corona positive and affected from it. I am begging all of your prayer and dua that may Allah recover her soon and may Allah lengthen her longevity. Please pray for her.
Yes, it is pleasure.
So-
It is our pleasure. He is
Yes,
with us with COVID-19 positive case. Yet he is COVID-19 positive.
Still she presented.
Yes,
She presented.
Dr. Nusrat Jahan Saima.
Congratulations. Congratulations for the spirit of perio.
Thank you so much, sir. Please keep me in your prayers.
Definitely. You will do well. Don't worry. Don't worry. You will be fine. Don't worry.
Chalo.
Thank you so much, sir. Sir, so the time has come. I am seeking your permission to our honorable judges. Sir, can we finish our episode today?
Dr. Anupam, are we supposed
Yeah.
to announce the result now, or I am supposed to send you the result separately?
No. You give me my result in my messenger.
Okay.
Yeah. Dr. Shaheen Bhai, you also give me the result in my messenger. And Dr. Naimur, you may declare the next session about the next session.
Thank you so much, sir. Thank you all of our respected teacher. So ladies and gentlemen, inviting all of you to our next 6th episode, and that was about periodontal instrument on 27th August, Friday. So I'm finishing today's session. Till then, be safe, keep safe. Good night. Assalamu alaikum.
Bye. Good night.
Thank you.
Right.